This is chapter 15, and we're talking about community pharmacy. In this particular chapter, we will be talking about community pharmacy, regulations, organization, customer service, processing the prescription, preparing the prescription, customer pickup, using a cash register, other duties. So the learning objectives are the following. At the completion of study, the student will have a basic understanding of pharmacy practice in a community setting, be familiar with the setup of a community pharmacy, understand the basic customer service principles, understand the basics of prescription processing in a community pharmacy, understanding the general duties of a pharmacy technician in the community pharmacy practice setting. Okay. Let's go to think it through. As you read this chapter, consider what you would do in the following situation. A customer is dissatisfied with having to wait for their prescription. An elderly customer tells you because of her arthritis. She has a hard time opening her medication bottles. She also tells you in a conversation that it was difficult for her to get to the pharmacy because she doesn't drive. A customer is asking what she can purchase over the counter to treat her cough and cold symptoms. And at the end, we'll come back to look at, think it through, and answer those questions. There's some great links that you can get to over YouTube. One is dealing with the independent pharmacy practice technicians, and other is just community pharmacy in general. They complement what is being talked about in this chapter. I think they will be very good viewing to accentuate your learning about community pharmacy. So let's begin. So community or retail pharmacy practice is the practice of providing prescription services to the public. Basically, close to 2/3 of all prescription drugs in the United States are dispensed by community pharmacies. One of the key characteristics of community pharmacy is its close interaction with patients. As you can see here, we have an individual that's working at a pharmacy, and let's say that he is explaining the label for the prescription to a customer. So there's a close personal interaction. And also there's a need for very strong interpersonal skills and providing good customer service. These are the essentials that you find important in a community pharmacy environment. So again, the practice of providing prescription services to the public. Almost 2/3 of all prescriptions drugs in the United States dispensed by community pharmacy. One of the key characteristics of community pharmacy is the close interaction with patients. So there are many different types of pharmacies. If you notice here in the picture, some of the three largest consist of CVS Pharmacy, Walgreens Pharmacy, and also Rite Aid. And these are considered as independent pharmacies. Also, you see stores who still have pharmacies such as A&P, Giant Eagle, Kroger's, Pathmark, etc. You have the chain pharmacies as located here. When we go back to independent farmers are family owned or locally owned. There are not too many of them at this time. And then you have a lot of the larger merchandising companies, such as Walmart, Kmart, Costco, Target, etc., that have their own pharmacies. So there are tens of thousands of pharmacies in the United States, and the community pharmacy are found in many different locations, in many different venues. One of the things that it should be noted is that there have been a very rapid growth. So rapidly growing aspects of community pharmacies are disease state management or DSM programs that have been developed, medication therapy management or MTM services, and other technical services and programs. So when we talk about DSM, we are talking about programs that provide one-on-one pharmacist, patient consultation sessions to help manage chronic diseases or conditions such as diabetes. When we talk about MTM, and I'll talk about that a little bit later, we're talking about services that are similar to DSM, but it's tailored to the provision of the Medicaid Part D. And remember when we talked about the Medicare Part D, that's dealing with the federal government assisting elderly individuals to pay their prescriptions. So MTM includes 5 key elements, and we will talk about those particular elements. Okay, so let's look at disease state management. This is the one-on-one pharmacist patient consultation sessions that can occur, and they may include, for example, general medication advice and information. That is, the patient may ask simply, how many times do I take this medication? When do I take it? Can I take those certain foods? Or what are the contraindications? I'm taking multiple medications, and even though that information is placed within the bag with the medication, it's also the responsibility of the pharmacist to give clarification. One of the things that's very important is diabetes education. Unfortunately, in the United States, you have a proliferation of type 2 diabetes, and so that is part of the management. Type 1 diabetes, of course, is genetically induced, and there are mechanisms by which they can work, by which pharmacists can provide education and monitoring. Asthma is a major problem. Everyone probably knows someone who has passed away because of asthma, and that is environmentally induced, sometimes genetically induced type disease, and monitoring of that is very important. But then you have chronic obstructive pulmonary disease, which is due to smoking, and so that is a education that can be provided by the pharmacist. Anticoagulation education and monitoring. You should be familiar with heparin and warfarin. Also, a patient may be on a low dose aspirin regimen, and that is if they've had a heart attack or other cardiovascular challenges dealing with coagulation. And so that type of education monitoring can be done by the pharmacist. Again, as mentioned, didn't mention it, but diabetes type 2 associated with obesity. Obesity is a major health problem in the United States today. So facilitating weight loss programs where a pharmacist action can occur. Smoking is still a problem in the United States. The number one cause of cancer is lung cancer. So it's a very preventable type of situation. And then cholesterol. Cholesterol is associated with atherosclerosis. It's a major health problem. Can be also associated with hypertension, and having a decrease in the cholesterol level can be helpful in better health and better living outcomes. Then I have this particular slide here, and this is basically what MTM was supposed to do. When we talk about MTM, we talk about the medication therapy management, medication therapy reviews, pharmacokinetic consultation with the patient, disease management, core and support over a long period of time, a economics and applications in which an individual complies with medication safety surveillance, making sure that the patient is safe to be taking the medication, and that leads to health improvements. And of course, with health improvements in the individual, there's decreased costs to society in general because of the interaction. And part of that medication therapy management is done by the pharmacists. And this is some of the tailored provisions that you find associated with Medicaid Part D. Medication therapy review, personal medication records, medication-related action plans, interventions and referrals, and of course documentation to see what worked, what did not work, and tweaking of the particular plan for that particular patient so that they have better health outcomes. Okay, there have been a evolution of the pharmacy. As you walk into any pharmacy in the United States, most of them, you find that there's a large, they sell almost everything, you know, even though they are a pharmacy. And I believe that the purpose of that is for profit. As you're walking by the aisles of everything else, you can pick up your card, your birthday card, you can pick up something to snack on. I don't know how healthy that is. They will have healthy snacks. Some places have bread and milk and little shopping center. And what they're thinking is that as you go to the pharmacy, um, and come out, you may want these other things to pick up. But one of the recent changes is what they call a minute clinic. Sometimes it may not be very convenient to go down to your regular health clinic to see your doctor. Your doctor's not available. You may not be able to see, go to the hospital. So with a limited amount of injuries and a limited amount of health concerns can be taken care of by what is called a mini clinic. This is what CVS calls theirs, but there are others. So these are walk-in clinics. These are not staffed by physicians, but by nurse practitioner. Notice we have a couple here talking about whatever issue they are. They've probably done a few purchases within the pharmacy. The pharmacy is close by, and they deal with minor conditions such as colds, flus, minor injuries, little scratches, little bruises. They also have a vaccination program, and they have been found to be very effective in providing those particular type of care. Okay, so we're going to stop here and continue on with the community pharmacy and some of the aspects of working with